Hi, I'm Aubrey Going, and today we're going to talk about tight hip flexors and how prolonged periods of sitting can contribute to low back pain. There are a number of muscles that can be described as hip flexors, and the action they do is to simply flex the hip. They decrease the angle between the torso and the thigh bone. When you think about it, that's pretty much the position we're in when we're sitting down. These hip flexors stay in a shortened state for prolonged periods of time. And that affects how the nervous system controls tone or tension within these muscles. And while there are quite a few hip flexors and each one can contribute to hip and pelvic dysfunction, there's one in particular, psoas, which is quite a deep muscle in the abdomen, that is probably most responsible because it's connecting to the lumbar vertebrae. So let's take a look at the angles, the mechanics of how this is working, and why it's going to contribute so much to low back pain. Iliopsoas is one of our major hip flexors, and it's actually two different muscles. So we have the psoas portion, which is attaching onto the side of the lumbar vertebrae, and we have the iliacus portion. We see this on the inside of the pelvis. And they travel through the front of the pelvis, just underneath the inguinal ligament, and they conjoin to form iliopsoas, where they attach onto the lesser trochanter, the inside of the femur. Now, the problem with psoas is when we're sitting for prolonged periods of time, the muscle gets accustomed to being in this shortened state. And you can see the way it has to bend around the pelvis for us to stand up. When we're sitting down, this muscle is almost in a straight line. So we see the red marks here on the side of the lumbar spine where the muscle is attaching, and we see the discs between the bones. So when psoas gets really short and tight, it can pull down on the lumbar spine, compressing the lumbar discs. That compressive force is what will cause disc material to bulge out to the sides. The disc material itself is made up of cross-hatched collagen fibers with a gel center in the middle known as the nucleus propulsa. If the discs get sufficiently compressed and they squash down, not only can the collagen fibers start to rupture, but that gel center will actually migrate and then start to impinge on the nerve roots as they travel out. Good way to think of this is the disc material is almost like a marshmallow, and when you squash it flat, it bulges out to the sides. If one side of psoas is tighter than the other, when we get this compressive force coming in, we might get a squeeze or a pinch down on one side as the bones compress, but the disc material will actually push out to the other side. So we'll oftentimes get neuropathy or nerve pain on the left-hand side due to a tight right psoas. So let's take a quick look at some therapy that can help release tightness within these muscles, and then home care that we can do to help maintain length and flexibility within these muscles. The central portion of psoas can be identified by visualizing a diagonal line from the ASIS to the navel and palpating the lateral border of rectus abdominis. Compression and gentle mobilization can prepare the tissue for pain-free deep tissue techniques. Active engagement and fascial mobilization are excellent for releasing adhesion in this short, tight muscle. The same techniques can then be applied to iliacus. Therapist-assisted stretches can then help restore length to these short, tight muscles, targeting either the iliopsoas or the rectus femoris by simply changing the position of the lower leg. The client can then perform targeted home care exercises to maintain the length and flexibility in these tight hip flexors. Hope you enjoyed this short video and found it helpful. If there's subjects you'd like to see us cover in future videos, particular injuries or explanations of anatomical structures, please do get in touch with us either by leaving a note in the comments, or you can email us at info@hcd.ie. You can also find information on our training seminars as well as our resource materials such as DVDs and books on our website. It's hcd.ie. If you'd like us to travel to you to provide a seminar in your area, please do get in touch. Thanks for watching.